Rhinoplasty and septorhinoplasty. The outside of the nose is made of two parts, a hard part made of bones, the top of the nose, and a soft part made of cartilage, the middle and tip of the nose. The cartilage and bone are covered by skin. Injury to the nose can lead to breaking of the bones of the nose, leading to a deformity. Deformities of the nose can also happen if the cartilage is misshapen or if the partition between the two halves of the nose, which is called the nasal septum, is bent. So what is a rhinoplasty? Rhinoplasty is an operation to change the shape of the nose in patients who have a deformed nose. This operation tries to fix the bony part of your nose to help you breathe. What is a septorhinoplasty? Sometimes the septum, the cartilage between the two halves of the nose, is bent and makes breathing difficult. If this is the case, we can do a septoplasty, which tries to straighten the septum. If we do a septoplasty with a rhinoplasty, we call it a septorhinoplasty. This shows a misshapen septum. So what does the operation involve? The surgery can be performed in two ways. External, we make small cuts under the tip of the nose, or closed. This is done from the inside of the nose. The type of surgery done will depend on what deformity you have, but the surgeon will tell you which one you will be having. In both operations, the skin of the nose is lifted from the cartilage and bone. Pieces of cartilage and/or bone may be removed or added to change the shape of the nose. At the end of the operation, the surgeon applies a cast on the outside of the nose, called a nasal splint, to keep the bones in place for a few days after surgery. The surgeon may also use a nasal dressing, which is called a nasal pack. So, what will happen before my operation? You will need to come to a pre-operative assessment clinic, which assesses your fitness for the surgery. Here we do some swabs checking for infection, request any necessary tests such as an X-ray, an ECG, which is a heart tracing, or some blood tests. You will meet with the ENT surgeon to discuss the operation in detail, including the risks and benefits, and then he will take your consent for the surgery. Your surgeon will also arrange for you to have pictures of your face taken before the operation. So what about on the day? On the day of the surgery, you will come to the ward or wait in the day room and the nurse will do some basic identity checks. You will then be seen by an anaesthetist and your consultant before you go for surgery. What about the anaesthetic? Your surgery will usually be carried out under general anaesthesia. You will be asleep during the operation. You will need to stop eating and drinking from midnight of the day of your operation. So what happens after my operation? Usually you can go home on the same day, but sometimes people may need to stay overnight on the ward. You will be seen by your consultant after the operation and he will give you advice about continuing treatment and follow-up. Usually we use a pack in the nose which dissolves after a few days. Using a salt water spray called Sterimar can make the pack dissolve quicker. You may be given other medication to take. Make sure you follow the instructions given to you about the medication because it will help reduce your symptoms. Your surgeon may arrange to see you in clinic 6 to 12 weeks following your operation. So, complications. Are there any complications? We need to tell you about the common and rare but serious complications of all surgery. Common complications. Bleeding, but it is usually controlled during surgery or with nasal packs. Your face around the nose and eyes may be swollen and bruised after the operation. The nose might feel blocked after surgery. This is due to the swelling in the lining of the nose. It could also be due to dissolvable packs which we leave in the nose to help healing. You may have numbness of the teeth after this operation, but this usually improves with time. Rare complications. A perforation or hole in the septum may occur. It is rare, but it causes problems like whistling, bleeding and/or crusting. Then further surgery can close the hole. An important note, This operation is designed to help the function of the nose, not the cosmetic appearance, as we are not allowed to do this on the NHS. It is very hard to give an accurate description of what the nose will look like after the surgery. It is important to have a realistic idea of what the nose will look like and to understand that a perfect looking nose is not always achievable. However, we will do our best to make your nose look as normal as possible. If you have any other questions, your ENT surgeon or nurse will be happy to answer any other questions that you may have. The Patient and Advice Liaison Service offers help and advice to those who have concerns about the treatment, care or support that they have received. You can contact PALS on 01752 517 657. Thank you.